morning again, everyone. Thank you very much for coming. Sorry for being a little late. We're going to go right into it. This is update on the issues surrounding the dengue challenge that we're faced as a country. You may recall that I gave a statement to Parliament recently explaining the issues, outlining the numbers, and also announcing a series of measures to try and address the issue across the country. We have decided as part of the communications program, because we really do need a whole of society approach dealing with the issue, to have periodic updates via the media to avoid any speculation, any panic, deal with any clarifications that are required, again as part of just being transparent in terms of the overall governance of the program. So I brought out the full team so I can minimize my speaking, and we have experts representing the ministry in areas of the environmental protection in terms of vector management and control, epidemiology, chief medical officer, and because Bustamante has been in the news recently, the lady to my extreme right is the senior medical officer from Bustamante Hospital. So I'll ask them to introduce themselves, and of course the permanent secretary is there. He's not a journalist, and he's subject to be asked questions if necessary. Also, Mr. Dougson Brand. All right, so I want to get the chief medical officer, Dr. Jacqueline Mackenzie, to just give you the clinical update, and then we can discuss some of the programs to date in terms of the rollout, and then we'll ask you to ask us any questions that you have, and we have a team here who can come in depending on the nature of the questions. Is that all right? All right, thank you very much.
Okay, morning everyone. First, I really just want to give you an overall context of dengue and what has been happening globally, because really and truly what is happening in Jamaica is really a reflection of what is really happening across the world. So dengue, as you know, as you might know by now, is the fastest spreading mosquito-borne viral illness in the world. In the last 50 years, its incidence has increased 30 times. And there's about an estimated 390 million cases per year. It's endemic in over 100 countries, and it occurs in annual epidemics. Within this region, the region of the Americas, since 2019, we have yielded the largest number of cases since 1980. Between the beginning of the year to Epi Week 39, which is about early September, we've seen about over 2.5 million cases of dengue, and that includes over 1,000 deaths. Now, of the total cases that we've seen, over 19,000 have been considered to be severe dengue. The number of cases reported in 2019, as of that time, about the beginning of September, is higher than the annual totals reported in ever before in the region. In 2019, the proportions of severe dengue has exceeded that observed in the previous 4 years. In the non-Latin Caribbean, the highest cumulative incidence in 2019 has been reported in Antigua and Barbuda, where they've seen 382.4 cases per 100,000 population, followed by St. Martin and then Jamaica. And at that time, we were seeing about 174 cases per 100,000 population. It's a little bit higher now. This was at the beginning of September. Now, PAHO has established a regional goal in terms of the number of deaths that we really expect to be seen. And that goal is to keep it on the case fatality rate, which is the number of deaths related to dengue, divided by the total number of suspected cases. And we want that to be below 0.05%. Now, in this region, over 10 countries, 11 countries had exceeded that. rate, including Jamaica. So that is just really just to give you an idea where it is that we are, Jamaica, in the context of the rest of the world. Now, as of November 21st, our National Surveillance Unit had in its database a total of over 13,000 notifications. Now, when we get these notifications, we have to examine them and to see if they meet the case definition. And of that amount, we have had 7,856 cases between 2018 and 2019 that have met that case definition. We had 1,064 cases in 2018 and 6,792 cases with dates of onset in 2019. So as you know that in January, we declared an outbreak because the number of cases exceeded what would have been normal that we would normally see at that time of the year. It exceeded the epidemic threshold. Now, in general, since January, there was a decline in the number of cases. We peaked in January, and then we started to gradually decline, still remaining above the epidemic threshold until about May, when we just touched below the epidemic threshold. But traditionally for us, it is our trend that as of June, July, we start to increase again. And that is exactly what happened because the rains started and we would have had increased breeding of the mosquitoes, and so our numbers started to go up again. And since July again, we have been above the threshold. In terms of the number of deaths that we have seen for 2018-2019 up until the 21st of November, we have seen 63 dengue-related deaths. Now, the cases that we have been seeing are in the age group below 14. That's where the most of our cases we're seeing, and that's where most of our deaths are occurring. The parishes that we're having most of the problems now, when we started out in January, we were seeing more cases in terms of per population in St. Catherine, Kingston and St. Catherine, and Kingston and St. Andrew and St. Catherine. Now at this toward the end of the year, since about August, we've been seeing a shift towards the western side of the island, and certainly in St. James, Hanover, Trelawney, and Westmoreland now and St. Anne, we are seeing an increase in the number of cases. So while generally speaking from October, we have actually seen a small decline in the number of cases, and with all the measures that we have put in place, we are watching this very carefully. But we are still facing a number of deaths that, you know, we are very concerned about. We had our first large review of the number of cases of deaths in July, and up to that time, what we were seeing was that there was a delay in persons getting attention. So most of the cases that we see that resulted in poor outcomes, persons were presenting late to hospitals, and most of our deaths were occurring within 24 hours of presentation to the Accident and Emergency Department. Now we've seen a slight shift, because what we're seeing now is a more severe cases. So we are seeing cases that are admitted for longer periods of time, but the rate of deterioration and the type of manifestations are more serious. So in terms of our management, early intervention is still key. Prevention of the mosquito breeding and the mosquito spreading the virus is still where it is, because while it is that we have identified that there are certain cases that are high risk, or sicklers or asthmatics, and as I said, our children, we still can't predict which case is going to have a severe outcome, okay? And which case is going to rapidly deteriorate. and therefore the stress still has to be on prevention of the illness in the first place. Now, we have put in several measures since the beginning of the year that continues in terms of the sensitization of our clinicians in terms of attending to these persons early and treating every case of dengue as being serious in terms of the advice, so that persons are aware what to expect, what to look out for, what we call the warning signs, and if any of these occur, to visit their healthcare provider. We know that most cases of dengue are mild and can be treated at home, but there are certain key things that we are constantly reminding our physicians, we are reminding the public that they have to pay attention to these, because early intervention is key to the management of the cases. So we have continued with this sensitization, and we have put in various measures in terms of how it is that we reach down to all public, private, general practitioners in making sure that everybody gets the message. We have also put in several measures in terms of the reviewing of our cases to make sure that we pick up where there needs to be improvement, and we continue with the continued education of our physicians and how it is that we manage the cases that are very severe now. Our latest initiative is that in conjunction with PAHO WHO, we have put together a clinical team that we are going to start having the deliberations once weekly with these experts from countries like Cuba, Brazil, 6 different countries that have seen severe cases, that we're going to be having weekly discussions with these clinicians and our clinicians to see if there's anything that we can do to improve our case management. So in terms of our case management, we have been doing a lot in terms of trying to improve that, in terms of the awareness of our physicians. And as you know, we have several ventures that we have been doing in terms of the vector control and the prevention of the disease. So I hand over to Minister who want to speak about some of those.
All right, thank you very much, Dr. Jacqueline Mackenzie, Chief Medical Officer. Okay, so the CMO has given the sort of update in terms of numbers, and we will continue to provide that. I will remind you that for weekly updates are also posted on our website. Is that so? On our website? Is it weekly, right? Weekly updates are posted on our website. So for journalists who would like to know what is the latest data, then they can visit the Ministry of Health website for those updates. Nevertheless, I think the interaction is important. We continue to take and encourage all Jamaicans to take the dengue challenge seriously. While we believe we are doing a lot as a country to create the awareness, to respond to the challenges both from the prevention side but also on the curative side, as was said by the Chief Medical Officer, it is still a clear and present danger, particularly to the more vulnerable groups, as was outlined, the younger population, 14 or younger, as well as to older persons, or senior citizens, or persons who have compromised immune system. So it's important that we continue to be vigilant. Now, you may recall that a few weeks ago, the Prime Minister and myself made separate announcements in Parliament addressing different work programs linked to dengue, as well as other areas of work. In my case, I announced a $1 billion program, broken out into supporting a range of activities. And I will just remind you of some of those. It was for the continuation of the 1,000 temporary vector workers to support the 212 or so permanent workers. So that would be extended going into the new year. They'll be available, moving around, doing house visits, giving advice, providing brochures, treating water that is contaminated or breeding mosquitoes. And that is an important part of the work to be done. That will continue to be done. Another important component of that was the procurement of 36 dedicated vehicles to deal with a sort of, to deal with fogging, to expand and enhance the fogging program. The truth is that we have relied to this point on our limited vehicles that we own at the parish level. Some of the stock is old, and therefore there's some downtime. We have also outsourced by hiring private pest control companies. Sometimes that is also unreliable, particularly when it comes to getting the vehicle-mounted foggers that are a lot more efficient. And so we have had a level of ad hocness in aspects of the country as it relates to fogging. So we took the decision, given the nature of the challenge that we face, to renew the fleet. And I'm happy to announce that the vehicles have been procured, the 36 vehicles, they're here. We're just waiting now on the vehicle-mounted foggers to go in the trunk or the back of each of the vehicles. And in another week, I am told, we'll be able to release to the respective parishes. Now that will be important because it will mean a more consistent fogging cycle. I'm told by the experts that we were fogging 1 in 21 days in terms of communities that were targeted, that were considered vulnerable. With the new fleet, we'll be in a position to do 1 in 7 days, which is a better scientific approach, if you will, to dealing with the mature mosquitoes and the control of that population. So we believe that the new fleet will add additional and enhanced support in the field as it relates to fogging, even though fogging only deals with one aspect of the challenge, and I think it's important to note that. So that will be deployed in a week or so. We had announced support for members of parliament or the political representatives, both councillors and members of parliament. Between myself and the Prime Minister, his announcement of a 3 million and my announcement of 1, each member of parliament would have at their disposal of $4 million to develop a program with some guidance from us as it relates to their particular geographic area, whether it's employing additional people, bushing, cleaning drains, identifying critical areas or solid waste, breeding sites, all of that combined once it targets addressing the issue. And members of parliament, as I understand it, are busy now preparing and putting in place those plans, which will create an enhanced presence on the ground. And they know their local environment, so we expect that it will add some efficiencies to what is already being done by our temporary vector workers. The support for these efforts will be in place or is in place by some of the agencies. So we had announced the Solid Waste Agency and NWA in particular. Solid Waste, of course, managing the solid waste, and that is, based on our assessment on the ground, is a major source of breeding. So they use tires, the old cans, the old refrigerators. We're trying to get rid of all of that. And so solid waste is resourced to be on standby to target particular communities and to respond. But with MPs and councillors involved, that will also provide greater eyes on the ground to try to, and coordination and leadership to deal with that. The same is for National Works Agency as it relates to larger drains that may have water that becomes, part of the breeding of mosquitoes. They are also involved in that process and are resourced to respond to the challenges that we face. I want to say a couple of other things. This CMO may have mentioned that on the, before I get to the curative, let me continue on the prevention side. The appeal to the public around inspecting their immediate environment continues to be an absolute priority. So we have a national media campaign which we have enhanced and expanded on all our platforms in the country, whether it's traditional media or social media, providing information, encouraging persons to look in and around their homes, to destroy breeding sites that could be literally in their house, And we have seen evidence of that because we do check to determine the AG's index, which is looking at where they are present based on number of locations inspected. And there's ample evidence to suggest that most of the breeding takes place in an environment that is domesticated, where persons live, exist each day, and more often than not, they deliberately put those things there, right? So that message is a message that has to continue. And frankly, we're going to have to influence behavioral change if we're going to take control of this dengue challenge, which, as the Chief Medical Officer said, is only likely to get worse going forward based on its historical pattern over time, not unique just to us, but globally. The studies are out there. You just need to Google it or go on WHO website, go on PAHO website, and you will see that what we're saying is it's not unique to us. It's a challenge that we face across the globe and certainly in the hemisphere. So it really requires a human element at the micro level in order for us to play a particular role. So that is important. The other that I want to mention is that we've stepped up where moral suasion doesn't work. We've stepped up the activities around citing persons who are acting as or in their environment, who are being a nuisance to others and to themselves, frankly. The law does allow us under the Public Health Act to work with the authorities for prosecution of persons who are harboring breeding sites in and around their homes. And I believe you can be charged up to $1 million if found to be in that position. The last data that I got from the Vector unit was that there were some 3,000 plus, 6,000 now. Okay, so it has increased 6,000 tickets, if you will, or notices given to institutions, to individuals, where breeding sites have been discovered and persons have not taken action to deal with it. So if we have to use the law, we'll use the law. I mean, ideally, we'd like persons to recognize that it is in their self-interest to act, but nevertheless, we have to do what is necessary to protect others, if not those individuals who are creating the nuisance. So that is happening. The other thing I want to mention and remind the public on the curative side, well, sorry, before I get there, the self-medicating that the CMO spoke about and the need for us to see our doctors if we have symptoms is very, very important. It has created some stress on the public health system because given this time of year, you do find that persons are now responding, and it has created some stress in the A&E in particular. We're encouraging persons to use their health centers because the health centers can become the first point of response as far as a clinical assessment is concerned. And avoid A&E unless you really are convinced that you have an emergency, or if you are referred to that facility by the health center, by your community health center, which is why we have extended opening hours, and that those particular health centers have been announced. And we have some up to 8 p.m. I believe there are one or two that may go on a little later. And that is to facilitate persons who work, who may come home from work, see some symptoms, displayed by a child, a loved one, or themselves, and who therefore, having come home, can go and visit a health center between the hours of the typical work day ending at 5 and 8 p.m. in the evening. We've seen a lot of take-up of that. We want to continue to encourage it because we believe primary health care is very important, and we need to depend more on our community health centers in order to benefit from that. We continue to push the blood drive, blood collection, because severe cases of dengue does require blood oftentimes. The blood bank is available. There are other facilities, other collection points. We encourage persons to notify or to make inquiries at the health centers or the hospitals as to where they can donate. And we will step up our sort of encouragement, if you will, for persons who can give or are interested in giving to donate blood. This is a society, by the way, that's characterized by trauma, and so blood is always in need, whether it's motor vehicle accident, domestic violence, or otherwise. But in this time with dengue, it's important that we are always prepared for those persons who have the most severe cases. On the curative side, I spoke to a couple of the things, but I just want to appeal to the public as it relates to the access to accident and emergency units within our hospitals. We have seen in recent times significant complaints or vocal complaints, because if you put it in context, context meaning the numbers that pass through a typical A&E versus the numbers that complain, one would have to conclude, any reasonable person would have to conclude, that our A&E performs far more good in terms of responding to the needs of patients in distress than the cases where persons feel aggrieved and sufficiently motivated to make complaints that may be national in proportion, whether through social media, main media, or otherwise. In other words, if you take up Bustamante Hospital for Children, which is a specialist institution dealing with children and therefore is going to come under more stress than most because of where dengue is situated, as was said earlier by the CMO. Younger people and parents in their interests, understandably so, will want to take their children to Bustamante as opposed to anywhere else because they know it's a children's hospital. You are going to find, it is inevitable, that you're going to find significant demands on the system, even to the point where the system has a difficulty in responding in a reasonable time. And the numbers at Buster points to that, and I'm going to ask for those numbers to be given shortly, so you appreciate in a particular month and month over month how Buster has operated in terms of the numbers. You're talking about thousands of people over a given month coming through that location. And I want the public to appreciate that you may find less than 0.5% of persons who move through that facility. In other words, 99.99% of those persons who get the treatment that they deserve, are satisfied with the treatment, and as a consequence, persons are relieved of the stress and the distress that they are in based on their sick profile. You are going to find impatience, you're going to find stress on both sides, and you're going to have some of these outbursts that we will have from time to time because of the nature of the environment. But it should not take away from the good that I think the doctors and the nurses and the system, based on how it is organized, responds to those concerns. I want to also say to the public, and maybe it's our fault as politicians, since I'm the only one in the room is representing that category of personnel, that there's nowhere in the world that you go that waiting for health services, particularly public provided health services, is not a feature of that experience. I mean, I've been reading some of the A&E experiences in Canada and the UK. People are waiting hours, and in some instances months, to get a particular procedure. And I'd encourage our journalists to do a little background when you're assessing, as you're entitled to do, some of these cases that are placed on your desks or brought to your attention. And you realize when you contextualize it, certainly on a resource allocation versus responsiveness, that Jamaica is not, as much as we continue to work to improve, we are comparable in many cases to some of the more developed countries that spend far more on accessing some of these services. Having said that, we still have to work to improve. It's always a work in progress. and I'm not taking away from persons' rights to express their concerns, but sometimes I think we beat up on the system so much and ignore some of the good, and a lot of the good that the system actually carries out. And I want to pay tribute to the doctors and nurses to date who have done a lot of work under severe and stressful circumstances to respond to the issues. I also want to make, and the final point on this, on the dengue issue. We are in a new era as it relates to the dengue threat, and I think the country has to come to terms with the regional and the global scientifically demonstrated context of the dengue virus, the Aedes aegypti mosquito, the threat that it represents to our population. The truth is that it has evolved, it has become more aggressive, it has greater negative impact or implications on the population, and therefore it requires a different paradigm in terms of the response. And it is going to require a whole of society approach, as we spoke to in the Parliament recently. It's going to require individual responsibility, where persons are not vocal only after they are exposed sufficient to be contracting dengue, but recognize long before that if they do certain things or fail to do certain things, they are going to be at risk, and therefore their behavior within their environment is absolutely a key part of the strategy to dealing with the Aedes aegypti mosquito and the dengue virus. That's one, which is why public education is so important. But secondly, our own response as a country, as government, as agencies, to management of solid waste, to fogging, new approaches to controlling the mosquito population will also have to change over time. And that is why the government has established the mosquito unit in conjunction with the University of the West Indies. And I'm going to arrange for some of you journalists to go and visit that unit, because they're doing some very interesting things there. We've established 2 insectaries. We're breeding mosquitoes, studying them, exposing them to different repellents or chemicals to see how to control the population. We are about to launch or start the pilot project around sterilization with the nuclear sciences. I think some of you should probably go and speak to Professor Grant, Charles Grant at the University of the West Indies. We can certainly arrange it to get a sense as to what the new technologies and the new realities are requiring of us. But the approach to dengue in the current dispensation is going to have to shift, to move in another direction based on the threats that are now being posed to our populations, not just in Jamaica but the region, as manifested in the statements by WHO and FAO, and by the number of cases that we have seen in recent times. So we continue to work on the program. There's a lot that you will see and hear in the days and the months ahead, and we will always be sensitive to the concerns of citizens and respond, and where suggestions are worthwhile, we will take them on board, because we don't claim total authority over all knowledge. We really need to work together as a team to control and to deal with the issues. All right, so that's my little, not so little, but nevertheless. I don't know, you want to speak directly about Bustamante and what's happening there? I think you should, given that your population is the most vulnerable. Just look at your numbers and...
Thank you, Mr. Good morning, all. My name is Michelle Ann Richards Dawson. I'm the Senior Medical Officer for the Bustamante Hospital for Children. I'm foremost a pediatrician, as well as one of the Jamaicans who are fighting this battle against dengue. Minister has mentioned that the majority of patients we're seeing with severe complications are actually children, patients under the age of 14 years. That has been our experience, and as other hospitals which also treat children with dengue, the complications have been very dire and outcome have been very fatal in some cases. Just to speak to Bustamante itself, which is the only pediatric hospital at this time, so we're recognizing that, we have seen a significant increase of patients and patients presenting to the hospital. Just to give an idea of the figures. So between 2018 October last year and 2019 October, we triaged about 6,000 patients in the A&E department. The numbers this year, 9,000. That's just for the 1 month.
Right.
So we moved from 6,000 to 9,000 in the same capacity, infrastructure, staffing. And whereas we, being proactive, started our drive from in July in terms of educating our staff, continuing educating our parents, recognizing that we have been in a declared outbreak from January 3rd, 2019. In fact, we've been at this for over 15 months. It's weary, both for the team as well as for parents and children. The impact has been dire. There's some children who come to us in an early stage with fever. We try to advise parents as well. What are the precautions? We try to break it down to simple language. Manage a fever. Do not use any non-steroidals. And for those who don't understand what it is, these are basically a group of pharmaceutical agents which they, in their own mechanism, can impair your ability of your blood to clot. And therefore, we have to stay away from these. Diclofenac sodium, ibuprofen, those are the generic name, pharmaceutical name. There are several products on the market, but to make it simpler, stick with the straight and simple paracetamol, acetaminophen. So there's a reason why we implore parents not to use the others, because the risk, it increases your risk for bleeding, which is one of the known complications of dengue. We also wish to implore parents and family members, because we know we have a lot of extended families here in Jamaica. If you're not seeing improvement within 48 hours, 2 days, seek help. It also means that we also have been sure that at home, we have a lot of parents who have medication in their cupboards. They may have gotten it from their doctors last year or in the year, and they're using it. Please remember, stick to the straight, the paracetamol and acetaminophen. The complications have been dire in some of the children, where it affects the liver failure, it affects the kidney failure, it affects the brain, it also affects your ability to, in your gut. So we have been seeing children, unfortunately, who come to us with severe bleeding. That is why when CMOS and Minister also spoke to the support, we're all in this together. We have to support each other, because this is a national matter, in truth and in fact a Caribbean and international matter. We also appeal for those who come. Ask your relatives, your friends, go and donate. For every unit of blood that we use, blood products, whether it be plasma or platelets infusion, the blood has to come from somewhere. And that is where the national drive for increased blood donation. As a country, we have to increase our volume that we are actually producing. That can only come through voluntary donations at this time. So we're asking, what can we as Jamaicans do? As Sam already mentioned, look around your areas. It may sound simple. Look around the house. Is there any flower pot you have with the saucer? Look in there. If you see any wiggly things, those are the larvae. Look around if you have old tires, cans, paint cans. There was an old ad where you saw them sticking in the bottom with the ice pick. It's a tried and true. We need to get rid of those areas. If there's anyone in your household who has the signs and symptoms of dengue, one important thing is prevention. Use your repellent. It's to be reapplied every 4 hours. The whole idea behind the repellent is that you prevent the mosquito from biting the infected person to spread to an uninfected person. So we all have a role to play in our community, right? So we ask that, as I mentioned in numbers earlier, we have increased 9,000. I don't think any other hospital is doing those numbers in terms of triaging and admissions. So we know that we have a challenge with our bed space. We are over capacity, but this is not the first outbreak, and it probably won't be the last. Therefore, we have to look for solutions that are lasting and that can deal with the outbreak as it is now. I also ask that patients with the CE, that is it, the more patients we see, TS patients, the more patients CE we'll have to have, because it means that lots more persons are presenting to the area, and we have to see every single person. And the purpose of triage is to decide who are the most critical, who need to be expedited, those which are not as critical to seek care through alternative methods. So I thank you for the opportunity to share, but remember, we're not in a battle against each other, we're in it together to ensure that we win as a nation. Thank you.
Thank you very much, Doctor. I wanted to just, before I ask you to come in with your question and pass the mic to me, I wanted to just say that that the discussion around making fogging, you know, there are some home remedies which I take note that maybe not enough of us are using or exercising the option to use, and I would certainly commend it to the populace. We normally see them sold in the retail shops. Don't want to endorse any brands, but insecticides, if you want to call them that, the home use insecticides, the one you use to spray, you know, flies and aerosol, right? It works. Those persons who purchase have it in their homes in the evenings. They do a spray through. It kills the bugs and the mosquitoes, and you create an environment that's relatively sanitized for that night, at least. And so one of the things that we'd certainly encourage is don't just depend on the Ministry of Health's fogging infrastructure to come into your community. You should do some of the you know, you can actually engage domestic products that are sold on the retail market. And what I'm going to encourage us to do, our PR people, is to probably place some of those on this site. You know, all of them, just get all of them, because we're not endorsing any. But we need to start encouraging persons to invest and take advantage of the use of those. The other thing I'd like to say is that I want to appeal to persons. We have had a couple of cases where, you know, I become impatient because when I hear of them, because I just don't think that, I think too many of us are just not coming to terms with the need for our own assertive action to reduce the risk to us and to others. There's one case, for example, which I won't name the place or individual, of a particular householder who lives uptown, okay, if you use that terminology, in a prominent community in Kingston, and who has a swimming pool that has been abandoned in their backyard, where the neighbors called to say the pool has water and shrubbery, because it's abandoned, even though they live there, and it is a major breeding site for mosquitoes, and that the neighbor says that their father, who is retired next door, is being inundated with these mosquitoes every day, and he's convinced it's coming from the neighbor. No, it could be coming from other places too, okay? So I'm not being extreme in saying that's the only source, but the fact that that represents a nuisance. And upon visiting that particular householder to explain that you need to deal with the water in the abandoned pool in the back of your yard, the householder refused to allow access, which he can't, and we eventually had access, and literally threatened legal action for anybody to tell him what he should do with his abandoned pool that is a major breeding site for mosquitoes, affecting all concerned, including himself. Apparently he doesn't care about that. I'm saying this to say that, you know, we need a society, if we're going to take the all of society approach, we need a society that is going to appreciate and understand that we have to be our brother's keeper, if you will, as we struggle to overcome this particular challenge. It's a challenge that threatens all of us, and there is no value in one person blaming another or one entity blaming another. I am convinced, even though I'm always open to suggestion, and I take note of some of the comments made by the opposition in recent times about more resources being required and that we're not doing enough, always open to new ideas and new suggestions, and from wherever those ideas and suggestions come. But I really do believe that we're at a stage now where we have to stop criticizing and start being part of the solution. Every time you criticize, tell me exactly what you would do that would make it better. If it makes sense, if there is a discussion that is required, that discussion can be had. It can be had at this level. It can be had at the parish level. It can be had, I didn't speak about the health committees at the parish, in the parishes, chaired by the mayor. I was at one last week in Trelawney where I met with the mayor, the councillors, the MP, and we had a discussion about the coordination at the parish level. So there are so many different avenues by which you can voice your position, make your suggestion. It really doesn't help, frankly speaking, just to be critical because you think you have to criticize. And I'm impatient of that kind of approach. And that includes not just the opposition, but it includes the neighbor who is refusing access. So I'm talking generally across the board that we have to do better as it relates to that. All right, so any questions on dengue? And then I'm going to ask you for 2 minutes for the CMO to talk a little bit about the flu, because the influenza is adding a lot of additional stress because it's a season for that. Any issues related to dengue first?
Dr. Dawson. Hi, good morning. Alka Saunders from Jamaica Observer. Can you give us some figures for Bustamante Hospital? Like in terms of how many deaths have there been dengue related since January? And in terms of the bed space, what's the capacity right now and how many beds do you actually need?
Okay, good morning. So your question is,
You know, journalists must get better mics, you know. Can't hear from one stage.
okay, so morning. So your question is twofold. One is about the dengue numbers, and the second one is about our bed capacity. So let me deal with the first one. So when cases are seen, they are deemed as suspected cases until confirmed. So that number was determined through the Ministry of Health, through the system that exists, through the surveillance unit, which will determine in the final analysis whether these are confirmed or not. So the numbers that we would speak to would be suspected cases. I actually didn't come prepared with numbers. This was a very, short notice that I got for this meeting. So it is best that the numbers will be decided by the Ministry of Health as the final numbers. I don't want to be playing in a number game. However, in terms of the second part, I can still give you a trend that we did have very high numbers January, February. It trended down a little bit by February, March, and May. In keeping what CMO said, we actually dipped below that was the lowest we had. But remember, early in the year we had drought, so we had very dry spaces. And once the rain started, that is when our numbers went back up again dramatically in September and October. As we know that this is a usual trend that once the rain starts, the eggs now that were sitting there now hatch. And that is when the mosquitoes come alive and are out at us. So it will increase your spread. Regarding our bed capacity, we are at 253 bed capacity hospital. The last time 50 beds were added to the hospital was actually after Hurricane Gilbert, and those buildings were opened in 1991. We've had no additional bed capacity added except for intensive care beds, which are added for the cardiac unit and coming with other expansion. But if there is a need for expansion, I'm sure Minister will speak to that in the near future.
So what happens if you don't have enough beds, right? What happens when you have an influx of cases where, it's an inpatient situation?
Okay. Well, to answer that is very simple. If you have already exceeded your capacity, that means there are going to be persons who would not have available beds. So what we do, we actually have to coordinate between the accident emergency department, and we'll admit there have been some delays in getting them up to the wards because a bed issue, but we still continue management and care through the CMO, Ministry of Health. There were some recliner beds which were made available to us, but however the bottom line is that we need infrastructure changes in order to add the beds, and those are ongoing even as we speak, that an additional area is being renovated to provide additional bed space.
Can I comment on that, if I may, with your permission? it is a fact that Bustamante Hospital for Children has not seen any significant expansion in infrastructure, except for the cath lab and the cardiac unit, the operating theater, which we opened earlier this year, which, as you know, was under construction for some time. And that is a specialized facility that focuses on cardiac care for pediatrics. Beyond that, however, we, in recognition of the challenges, beyond that, in recognition of the challenges of pediatric care and the capacity issues that exist across the country, the administration, the government has put in place a number of plans that will see significant expansion over time. I'm sure you're aware of the groundbreaking ceremony we had in Montego Bay, which will add 220 beds for pediatric and adolescent care. So that will take a lot of pressure off the Bustamante from that side of the country, and that's going to be built out over a year and a half. In addition to that, we are now in the process of developing or doing designs to add additional bed capacity at Bustamante. I don't want to go too much into it. I'm hoping to unveil those plans before the end of this financial year. Okay, and it will include additional bed capacity and some additional facilities, not just for, in other words, not just for patients, but for parents, because there have been some discussion about parents having access for breastfeeding and other things. We're sensitive to that. We have some resources in place. We're now doing some designs. You may, if you have visited Bustamante recently, would have seen also a pharmacy being built there, NHF building a pharmacy. And for the cardiac and cath lab, we need some additional capacity here. So we have, I'm prepared to say there are some big plans for Bustamante Hospital, even while we build out in the West. Having said that, I want to caution us in thinking that you will always have sufficient capacity, particularly in the peak of any sort of outbreak. The public health system is not built to deal with peaks. Otherwise you're going to have excess capacity more often than not, and that carries a cost. So you have to manage logistically when you have peaks, as you have in this case, which is why we announced that the University Hospital of the West Indies, which is normally a paying institution, would allow during this period 12 years and younger to access free. And so the direct answer to your question is, to the extent that they can or need it, Buster can refer patients to the University Hospital of the West Indies, and indeed we have asked parents to take their children there as an alternative to Buster, and the University Hospital will not charge during this period of time. So that would address all the excess capacity. I didn't mention the fact that one of the other disturbing things we have continued to witness is the aggression towards our vector workers. Yesterday we had an incident in Trenchtown, is it? Where a worker was stoned, and it has created some anxiety. Trenchtown, one staff sustained non-life-threatening injury. He was treated in the evening at the comprehensive clinic. So again, even while we recognize the threat to all of us, we still have cases where persons are being negatively responded to in communities, the latest being in Trenchtown, based on the reports that I have. And I want to really appeal to Jamaicans to recognize the importance of the vector workers, give them access, and listen to them, because they are trained in order to provide some guidance. Any other question on dengue?
Minister,
Oh yeah, you want to do that. All right, CMO wants to just clarify the Bustamante numbers in relation to the question you asked.
Right. First of all, I just want to mention that Bustamante is a major referral hospital for pediatrics, and so deaths that would have occurred at Bustamante may not have necessarily originated in Kingston and St. Andrew. If we look at the number of deaths that we have had at Bustamante Hospital from January 2018 until November 21st, 2019, there were 19 deaths that were recorded. However, if you look at the number of deaths per parish you would have realized that we'd have had 13 deaths from Kingston and St. Andrew. And in that Kingston and St. Andrew deaths, we would have had deaths from Bustamante, Kingston Public Hospital, and the University Hospital of the West Indies. So we have to consider that many persons would have been seen in outlying hospitals and would have been referred to Bustamante, and these would have been more severe cases, some of which would have gone straight to the intensive care unit at a point when they were very, very ill.
Okay, any other question? Yes, Prince.
Minister, I work in Canada, so I'm not sure if you touched on this. There was a proposal for the government to use biological interventions such as sterilization of male mosquitoes to tackle the dengue issue. Is this something that the government ministry is undertaking?
So I spoke to it, but just for your benefit, since your name is Prince, let me respond to it directly again. Because I heard a news clipping on your station, I think it was this morning, where one of our noted clinicians in public health spoke to some of the things that we should be doing. And I just want to say that a number of what was said, we are in fact doing. So take the clinical issue of sterilization, which was one of the talking points. We are actually in the midst of carrying out a sterilization program with nuclear sciences. Professor Charles Grant at the University of the West Indies, head of nuclear sciences, you're welcome to speak with him. And we're doing that in a conjunction with himself. His unit, his head office is in somewhere in Europe. They are developing the pilot. We have created the infrastructure. We have 2 insectaries, one at the National Public Health Lab, one at UWI. Again, you're welcome to visit those facilities where we're now breeding mosquitoes, different varieties of mosquitoes. We have a mosquito unit at the university, again, studying the responsiveness of the repellents and the chemicals that we use, natural or otherwise. So, as I said earlier, this is a new paradigm. It requires new approaches, and we are actually engaging those approaches, including sterilization. The other point I want to respond to is whether or not we were mapping the country, which was another feature of your conversation, to determine responsiveness. And a specific thing was noted about mapping where the cases originated. It is the most basic part of our plan. Communities that have high vector index based on the assessment of the team are communities that are targeted. We don't just go, in a sort of ad hoc way and go all over the place. There are more vulnerable areas because of mapping, and part of that mapping is also based on the clinical diagnosis of where cases originate. So it's routine, almost. Well, not almost, it's routine. Yes?
Right, I just want to add that we don't just map in terms of numbers. We physically map the number of suspected cases that we have, confirmed cases and deaths. And we target those areas, and those maps are sent out to the parishes on a weekly basis. So they have that data to be able to work from.
Okay. Any other?
The matter that you raised regarding the vector control workers who were stoned in Trenchtown,
right.
Are you able to say the extent of the damage that the person?
Well, I'm told that the person was treated at comprehensive clinic. The truth is that it shouldn't happen, right? I mean, we're very relieved that it was only, they were treated and released, but it could have been a lot worse. And frankly speaking, for the life of me, I can't understand why you're trying to help somebody and they're refusing the help in that kind of aggressive way. It's a reflection, unfortunately, of the challenges we face with this issue, where people are just not retaining sufficiently to appreciate that there's a threat, that this has to be a part of the approach to dealing with that threat. Instead, they interpret that threat as some aggression to them, maybe, I don't know, so they take this kind of aggressive action. It is hard to understand, but nevertheless, we have to press on. So we will continue to think. I should mention too that it is illegal. And so if people are aggressive and bring health workers in harm's way, they can be prosecuted. And we will not be afraid to do that either, because the message has to be sent clearly that these are persons doing a public good. It's an essential service. We have an outbreak, and they should be allowed to do their job in the interest of the public. And so if one person don't care, the majority of people do. So I think that's an important warning that we need to issue to all concerned. Any other questions?
Minister, just to follow up on that, do you think at this point we need to enlist the assistance of the police?
We do from time to time. Where we think it's necessary. As I've said, I mean, some of these warnings don't come with sticks and stones. They come with threat of lawyers and legal action. And in those cases, we use the law to enforce. As we've said, 6,000 have been issued in recent times. So if we have to, we will. As you know, the police is stretched, but we think this is also sufficiently important. Any other on dengue? All right, so I'm going to ask the CMO just for 2 minutes, just to tell us about the flu season and what we can expect.
In the whole dengue coming up to the declaration of an outbreak, I think our messages for influenza got lost in the dengue noise that there was. But this year, as was last year, is a very active season for influenza. Our numbers that we have been seeing are certainly greater than what we saw last year. And so therefore, we just want to make an appeal to the public that they have to exercise caution when it comes to influenza-like symptoms. They must seek help from their private practitioners at the health centers or at the hospitals when their symptoms are severe. Because as of I think the end of September, we have seen an increase in the number of hospitalizations. We have seen an increase in the number of acute respiratory illnesses that are presenting to our health centers. So the cases of influenza also have the potential to become very severe, and especially in the very young and the elderly persons with chronic diseases, diabetes, hypertension, cancers, any illnesses that compromise your immune system, you are at risk. So we're asking you to make sure that you seek help, get help early. Most cases of influenza can be treated at home again with rest, fluids, treatment of the fever. But if your symptoms are severe or if they're persistent, and if you're in one of those vulnerable groups, then you must seek help. We also want to advise the public that we have vaccines that are available for our vulnerable populations. We have received over 25,000 vaccines as of October this year. Our target is to vaccinate healthcare providers who are on the front line and our vulnerable groups, the elderly, the young persons, and the persons that have chronic illnesses. So we're asking you to visit your health centers so that you can be vaccinated if you're in any of these vulnerable groups. And we also want to make an appeal to all our healthcare providers that they must take up the offer to get this vaccine that is available in the hospital and at the health centers free of cost.
Okay.
Is the ministry planning to boost the public education campaign regarding it?
Yes, and we have started. I mean, we have issued our press release and we have started the distribution of stickers in terms of the vaccinate for persons to see that I have been vaccinated, you should get your vaccine. Flyers or ads for the media in terms of newspaper ads and in terms of radio and television. Those are also being worked on, and by next week I hope that we will be out there and everybody can see that we must be prepared and take the precautions for influenza.
One other issue, the hand, foot and mouth disease. Have you been getting increased reports of that? What's the situation with that?
I'm going to ask, yes, we have been seeing sporadic cases, but I'm going to ask Dr. Webster Carr, our epidemiologist, to comment on that.
So for hand, foot and mouth disease, we have been seeing a few cases. There has been no clustering. The western region in particular has been noting more cases, but this is usual, what is usually observed. There is no unusual occurrence of hand, foot, and mouth, which is a condition that we see all the time. But we note from some parishes that they had some cases which were not clustered, meaning they are not connected. All right?
Is there a usual season for this particular condition as is influenza?
So there are certain times of the year that we tend to see hand, foot, and mouth, particularly June, and then we have a break probably because of summer holiday, and then in September, October, we usually see it again.
Okay, sounds interesting. Yeah. Oh, okay, since this might be the last one before Christmas. All right, no more questions on flu and dengue. I just want to, first of all, thank you for being here and for participating and, of course, helping us to continue the messaging to the populace. Just in a minute, I'd like to say that I don't want to be sounding too philosophical, but we have a challenge in our society that is less clinical and more behavioral. And public health is going to have to respond in the years to come around behavioral change as opposed to getting more experts. Not that we don't need experts. We have great doctors and nurses. They are not enough. We need to get more. But it's not like we need another degree to appreciate the treatment that is required once persons become ill, either communicable or non-communicable diseases. What we need more than ever is to get Jamaicans to change their behavior. That is, in the first instance, more preventative in terms of self-inflicted conditions, whether because of breeding sites and dengue or car accidents and head injuries. And once the behavioral changes can take place, I think you're going to see not only a gentler society, but a healthier society, which is why we place so much emphasis on wellness. Because the wellness agenda is about how do you develop a state of mind and, by extension, a state of activity and interaction with your community, with your family, with your friends, with your neighbors, with the environment that provides for you a more a healthier context to exist in. And I frame it that way to say that we're now approaching the holiday season. And for those of us who track healthcare services, you know that during the holiday season is when persons tend to overindulge, merrymaking, the parties, the drinking, the eating, and you know, we appreciate the need to rest and relax and to recognize the season. But it also is a period when we tend to have a spike because of excesses in our accident and emergency rooms and persons needing to be admitted. Whether it is because of food-related issues, overindulgence, drink and driving and road motor vehicle accidents, trauma from domestic issues because of persons' minds are altered because of consumption of mind-altering substances. It normally is a challenging period. Now, on the back of the dengue challenges and the flu challenges, we really want to try and minimize the other trauma-related challenges. So I'm really appealing to the public, using your means, to exercise some additional caution this Christmas season. Enjoy the period. You know, spend time with friends and family, relax, rest, reflect on what the season really means in the Christian calendar. And please take care to protect yourself and those around you by your behavior, because it really is going to be a behavioral issue. So that's my moral, what do you call it now? You're a church lady, more than this. That's my moral minute? All right, my moral minute for the day, right? Thank you very much for coming. Thanks a lot.